Well, hello, everybody. My name is Benjamin Day.
Me, I'm Jillian Mason.
And this is Medicare for All, the podcast for everybody who needs healthcare. So, Jillian, today we're going to be talking about the other half, unless some of our listeners are the other half, and then we're talking about you.
Ooh.
So, for most of us, if you've had an experience with the American healthcare system, you probably walked away thinking why can't I have nice things or even basic human things sometimes? I know between the two of us, we could go all the way down the list here, probably getting stuck on gurneys, sitting in ER hallways, waiting hours for care, skipping other basic needs and things like food and housing just to pay for the healthcare we can't skip, or waiting months for preauthorizations from health insurance, referrals from doctors, and so on and so forth. Even when we have insurance, it feels like nothing kind of works for us smoothly for the care that we need when we need it. But of course, if you are super rich, you probably don't have to endure any of these humiliating experiences because they have developed some new fancy ways to get the healthcare that they need exactly when they want it. So put up your pinkies and throw up a monocle, because today we're going to do a deep dive into the lifestyles of the rich and famous and to find out just how fancy is concierge healthcare, and can the rest of us get us some of that.
So, no spoilers, but maybe not.
Well, we'll find out. Teaser. Maybe I'm hopeful that the whole point of Medicare for All is we can get some of that. So pinkies up still a little bit. Stay tuned. But, Jillian, so we're going to take this in two pieces, really. We're going to talk about physician care first and hospitals second. Starting with physician concierge care, though, which is kind of the latest trend in fancy healthcare. What exactly is concierge care when it comes to doctor services?
Well, I would like to begin by saying that that concierge care is fancy because it's called concierge care.
It's French. It must be.
It's French. I mean, how many people in this country are staying at hotels with concierges? Rich people are basically getting White Lotus healthcare, and the rest of us are getting Motel 6 healthcare. Very sad.
Nice reference.
Thank you. Some concierge plans are different, right? So some of them, they are also called a million different things, including direct primary care. So some of these plans work with existing insurance, and those are the cheaper ones. So they can go from $600 to $1,000 plus a year. So that's Hyatt care, right? Some of these, though, you actually pay a flat fee that covers all your services. So you don't pay for insurance in addition. And those are the really expensive ones. And they can run you from $2,400 to $30K per year. So crazy.
Affordable, in quotes.
Affordable. Right. Exactly. Yeah, totally in the range of most people. And then, so you might be asking, what do you get for your money? And I'm going to tell you. You get 24/7 access to doctors. Some of these services actually promise you your physician's direct phone number, which is...
So you can fuck with your doctor at 2 a.m. in the morning.
And he has to take it.
It's I just left the bar. I'm not feeling so good.
How wild is it, though, that we have gotten to the point where having your physician's direct phone number is a premium luxury service.
So sick.
In addition to that, you get some coordination of care. So if they're working with your insurance company, they deal with all those pre-authorizations and stuff.
Oh, that would actually be very nice.
Right? You handle your referrals. It's basically someone walking you by the hand and getting you the care that you need. And then sometimes you can get extra services like a health coach or something like that, not strictly medical. And then finally, like some of them offer like crazy shit like home visits, which I mean, when's the last time anyone got a home visit from a doctor?
Should not, still practiced in many countries, but it's crazy here.
Yeah, right. And so, the doctors, one of the big benefits of this, right, is that the doctors who participate in concierge care or direct primary care, whatever you want to call it, they typically have a patient panel of no more than 600 people, right? So they see 6 to 10 patients a day, and they spend at least 30 minutes with each of them.
Right.
So,
and 600 may sound like a lot of people, but it's actually not for a primary care doctor over the course of a whole year.
Yeah, absolutely. But yeah, 6 to 10 patients a day, and they get to spend at least 30 minutes with each of them, which is such a luxury. Right? When I go to the doctor, I'm in and out in like 15 minutes, and half of it is me actually just filling out questionnaires on an iPad about whether I feel safe in my home.
Or 3 different people, 2 minutes each. Like
right. Exactly. So at this point, this has become tremendously popular. There are like 1,500 concierge care practices across the country.
That's not doctors, that's like practices.
That's right. Practices, right, which contain many doctors.
Right.
And then, of course, at this point, like 1 in 5 rich people, like people in the top 1%, are buying concierge care.
What's wrong with the other 4? They're behind the times.
They're rich people who are of the people. But I did want to mention, though, that
they own their own hospitals.
They own their own hospitals. They probably own their own doctors. There's a lot of shady shit going on once you get to the top 1%. Yeah. So I did want to mention, though, Ben, because we're talking about like the super rich here or whatever, that like for those like less expensive concierge plans, like that they are accessible to people who have like an extra $2,000 in their budget over the course of a year, which is, a lot of people don't, right? I think the statistic is that most people don't have an extra $500 in their bank, right? Like
we have negative extra money usually. But
that being said, if you're like a middle-class person, it is possible for you to access this. And I've noticed that it seems to be really popular in where I live in Texas, which kind of makes sense to me because the healthcare system here, as we've talked about many times on the podcast, is so bad, right? That people feel like it's worth it to pay that extra amount of money to get some decent healthcare.
Yeah. And I, in preparation for this episode, I actually prepared for this episode. Shocking. Yeah. I looked up where.
Believe it when I see it.
I looked up where I could get concierge care in Boston. And lo and behold, actually the biggest hospitals in the city offer concierge care from their own physicians, like on staff physicians. So Mass General, the largest hospital in the state, and it's also part of the Partners healthcare system, which they just own everything. They're like 75% of healthcare in Eastern Massachusetts. They have this whole website, Concierge Medicine, and despite what you said at the beginning, which is that the plans where you also need health insurance on top of it should be cheaper. This is not the case at Mass General. You at Mass General, you pay $10,000 per year to join their concierge healthcare plan.
I'm sorry, Ben. I just feel like I have to interject here. Like, I just have to like give just like a glimpse of the other experience at Mass General, which is that like their psych ward is directly next to their ER. When you go to their ER, it is a traumatic experience. It is like being in like a 19th century asylum or something.
Yes,
like that.
I remember being there with my brother not that long ago when he ended up in the ER.
I mean, it's shocking. Like people screaming. Like it is a really, really shocking experience to be.
And it's a downtown hospital. It's right in downtown Boston. So.
Right, exactly. And they provide great medical care, and their safety net has whatever. But also, I just want you to know how dramatically different when we describe what this concierge care
exactly. And this is not even we're gonna get to later the like luxury hospital shit, which you can also get at Mass General. This is just for your primary care doctor. So if you want the real luxury concierge, just primary care, $10,000 per year, and then you also have to have insurance on top of that. They have a helpful FAQ on their website that says, do you need to maintain insurance? It says yes. Then membership fee covers an exceptionally high level of service, access to your Mass Care General primary physicians 24 hours a day, 7 days a week, coordination of specialist care as needed in state-of-the-art facilities. It does not cover the cost of the medical care delivered to you. So $10,000 a year, you get no medical care for it. When that concierge primary care doctor you get assigned to gives you medical care, they bill your insurance company. So
this actually makes sense of why they call it concierge care, right? Like if you think about the concierge at the hotel,
that's right.
You go down to the concierge and you're like, I'd like a nice dinner. They are going to
exactly
tell you where to go to dinner, but they're not going to cook it for you.
They're not going to fix your dishwasher. They'll just find you somebody who can, right?
Right, and then you're expected to tip them on top.
Right. But for this $10,000 a year, and this will become important for our later discussion. So Mass General has a small-ish staff of primary care doctors who are the concierge medical primary care doctors. They only treat the concierge patients and members. They don't treat all the other plebes who get primary care through the hospital. And so they're the ones who, just like you were talking about earlier, have a much smaller caseload. They see fewer patients a day. They have fewer patients in general who they're responsible for over the whole year. But think about this. You're paying for your insurance and then $10,000 on top of that just to be able to access the nice, like, doctors who aren't overwhelmed with patients. And they give you like a few extra services like 24/7 phone lines and stuff like that. So, but I was totally shocked by the cost and, to my eyes, how little you get for it, you know. But
yeah, but also, like, think about those things, the scheduling, right. Those are the things that really give you a lot of agita, other than the money, which
it's true.
Like, I think 90% of agita around healthcare is about the money.
Right.
It looks like they take care of the other 10%.
Yes, and you get same-day appointments. They also throw in a health coach and a dietitian.
I have always wanted a health coach
and a dietitian.
Don't know what it is, but I'm sure I want it.
It's great. They give you pep talks before every health-related decision. I don't know. Go team.
What are you gonna do? I mean, that like actually sounds like super awesome, despite the cost. Aside from money, right? Aside from the cost of this, it sounds super awesome. So what's the downside of concierge care? Like, what's the downside of some people just get better healthcare?
Well, I mean, you can see how this is kind of like a creation of our fucked up healthcare system on both sides, for the patient side and for the physician side. So, for the physician side, it sounds pretty good. Like, what doctor would not want to, I mean, it sounds like some of them still have to deal with the insurance companies, but dealing with far fewer patients, you get to spend more time with each patient, actually provide care, listen to people. You're not being forced by an insurance company to kind of churn as fast as you can. It's like turning over tables at a restaurant, it's just like turning those patients. So it must be, despite having to just treat rich people with a lot of sense of entitlement, which might come with its own downsides, it's a little bit more like the practice setting that doctors would want to be in. But guess what? It actually, there's an article in Scientific American about how it's exacerbating the already pretty bad primary care shortage, primary care provider shortage. And it's starting to create this growing two-tier system. As we see more and more doctors are
a two-tier system in American healthcare?
Yeah, unheard of, right?
Actually, it's probably more like a four-tiered system, but yes.
Right. I mean, we already have tiers for like your insurance coverage, but usually you don't see like the tiers in providers, where it's like, I'm a rich person doctor, so
yeah, that's a really good point.
So now it's like, on top of the insurance level discrimination, there's also like a provider tier. So obviously, if you don't want to deal with a primary care shortage and you have enough disposable income, you can buy your way out of the primary care shortage crisis in America. But guess what? That actually exacerbates the primary care shortage for everyone who can't buy out of it, because there's fewer doctors treating everyone else. And obviously, the doctors who are in the system are seeing fewer patients. So anyway, it's bad for the rest of us. And this is something we're going to come back to a little bit more when we talk about hospitals. But another area where it could be a downside of concierge care is there's actually very little research on whether it works, whether
Yeah.
whether you have better health outcomes if you are in concierge care. And there's a real shortage of any peer-reviewed studies looking at this, because it's also kind of a pretty new phenomenon. I feel like
Yeah.
a lot of the resources we're looking at saying 10 years ago there was just a handful of these, and now it's becoming very prevalent.
Right.
So you might think, duh, no brainer, this must be better for your health outcomes because you're getting more attention from your doctors, you're seeing your doctor more quickly, you're getting all this kind of, the health coach, the dietitian is going to help guide you through your health decisions in life, and they're going to fight on your behalf with your insurance company and handle all that shit for you. It sounds great, but there are some potential downsides that we're going to come back to. But for now, let's just say it hasn't been studied. So people who think they're getting great care, they don't know that they're getting better care.
It's true. It's true. I just say anecdotally that my buddy Sandra, shout out to Sandra, love you. Sandra, who has concierge care, she says that she does like it. She says that she feels like her care is more integrated, and then she gets better access to doctors or whatever.
Yeah.
But so just anecdotally, Sandra's digging it, but that doesn't mean it's working for everyone.
Right. And theme of this program is going to be, I mean, some of the concierge stuff, especially the hospital stuff, gets wild.
Oh my God. Yeah,
but some of it kind of feels like just doing good healthcare that all doctors want to be able to do anyway, and so in that respect, it should be good for patients' outcomes if you can afford it. But again, no research showing that that's the case. And there are some reasons to believe that there are things working against you when you get concierge care as well that might actually harm your health outcomes. So let's get on to the juicy stuff here, because we kind of slow played this. We talked about the physicians thing. Hospitals, this is where things get really wild. So I honestly didn't know anything about this before we started looking into this show. I just assumed that when you walk into a hospital, you just kind of get treated the same way. But Jillian, you're going to have to disabuse me of this and tell me what the story is actually at hospitals.
This is a little like the the Anna Delvey story, right? That like heiress or whatever who pretended to be someone else or whatever. But she says in the Netflix movie, she goes, "There is always a VIP." So it turns out that that's true in the hospital too, which is so disappointing. So one thing that I learned from 2015 op-ed in the New York Times, it was really, really good. It was called "How Hospitals Coddle the Rich," and it was written by this Brigham and Women's doctor, Shoelle Clark, and she talks about something called. We'll come back to Brigham and Women's later because. Man, there's some
another
shit going
Boston
on
institution.
There is some shit going on there, but she talks about the practice of red blanket patients, which I had never heard of. But basically, hospital staff, when they see a big donor in the ER, they put red blankets on them to mark them as VIP. Now, obviously, not every hospital does this, but surveys suggest that this is actually a practice in many hospitals all over the country. So, when you're going to the ER, bring a red blanket with you.
Right.
That's my recommendation.
Hammer and sickle flag on there, optional.
Optional, purely optional. Oh man. So then you're in the ER and you've got your red blanket on. You're not just going to get admitted to a regular room, Ben. You are going to get admitted to a very fancy luxury suite. And a great example of this is the Brigham and Women's Pavilion The
Mhm.
pavilion is the private room floor within Brigham and Women's Hospital. Again, like Ben said, a Boston institution,
Mhm.
a wonderful hospital. I know a lot of people who have gotten spectacular cancer care there, but also.
The pavilion.
Do you want to talk some more about the pavilion? I know you dug in there.
Oh, would I love to ever. And have you ever gone to a hospital and been offered even any of this stuff? I guess you have to know. You have to know before you get. Either you have to know in advance, or people just look at us and they're like, "No, no, we're
Yeah,
good."
no, I think that I think they just look at us and they know.
Right.
Yeah.
We don't have the platinum insurance card or something.
Yeah. I've been lucky enough to get my own private gurney in a hallway.
Mhm.
And I was left
Lovely.
alone in that hallway for over 24 hours. So it really was private.
That's yeah. Well, this is going to resonate with you because sounds
Good.
exactly like your ER experience. So here is the Brigham and Women's own description of the pavilion. Patients who stay in the pavilion, their family, and those accompanying them during their stay will notice the spacious and well-appointed rooms of the pavilion, more like a fine hotel than a hospital, as well as the modern facilities that can accommodate their personal and business needs. Jillian, amenities include luxury features, including fine china and silver, warm wood treatments, and custom cabinetry.
Oh.
Fine dining, gourmet food service for patients, depending on their dietary requirements, extended hours, and the ability to accommodate specialized dietary needs. So if you get a little hangry at 2 a.m., you can just place an extra order. You can choose either a deluxe private room or a deluxe suite. The suites include window pane pocket doors that lead to a separate seating area with a sleep sofa for family member or a visitor.
Or if you have help with you, because you wouldn't
Oh,
want to go to
yes,
the hospital with
the
a
butler,
butler.
yeah, right,
Right.
exactly. Full-size tiled baths with luxury features you would expect. I don't know what to expect. I wish they had spelled that out for me. Fine linens and spa robes, toiletry products, including blah, blah, blah. Kitchenette area with mini fridge, in-room safe, wireless internet, flat screen TV. And I love how they mention a fax services upon request. I don't know who uses faxes still, but clearly it's important. So I don't know how much this costs, but an
Old rich people.
Yeah. Are they still faxing to each other just in their spare time?
Yeah, just back and forth.
So I refuse to email. So anyway, I don't know how much this costs, but a 10-year-old article listed this as $300 to $800 per day. I'm sure it costs a lot more than that. We're probably
I'm sure it's only gone down since.
Yeah, I'm guessing probably $1,000
yeah.
plus a night. So actually more expensive than a luxury hotel. So
yeah, seriously, I was gonna say you could definitely get in at the Omni Parker in Boston, which is in my opinion the best hotel in Boston. You could get a suite there for way cheaper.
You just need to bring those medical staff with you.
Yeah, I suppose that's true. That's true. I guess when you're rich, you have a lot of options. But so this then led you down a rabbit hole on Reddit, which as people know is one of our favorite things to do.
100% accurate, very well sourced material we're about to bring to you here. But there's a Reddit thread just asking about hospital luxury units. And so many healthcare providers chimed in about the luxury units at their hospitals that they work at. And I should say, we did find there are even whole hospitals that are only luxury hospitals.
Oh.
Who knew? If you don't want to interact in any way with the riffraff in any hallway or entrance to the facilities. So there's a lot of really interesting stuff. As you said, the big donors in the hospital tend to be flagged for the luxury units and the red blankets, maybe if they're in the ER. I'd say by and large, providers think that this is a disgusting practice, and they don't think, oh, how amazing that you get to spend more time with these patients.
Right.
I think even more so than the concierge primary care, the hospital bed, the luxury hospital units really offend providers.
Yeah.
So
which makes sense. You're in the hospital, you see literally from floor to floor the major differences.
Yeah. And I should say the pavilion, and I looked at a few other luxury units at other Boston hospitals. They all are on the top floor of like their tallest buildings. So you get like these panoramic views and big windows and all that stuff. So anyway, this nurse, this emergency department nurse said, I was told that they are deserving of, quote, a higher standard of care than regular patients because of their generous donations. And they are assigned a specific coordinator who helps them grease the wheels of getting them to their private room, have in-room catering, are visited by the AOD and other hospital administrators to make sure all their needs are met. This nurse says, this rankled me in the worst way for the longest time. What about the poor guy with pancreatic care? What about the teenage mother who just lost her full-term baby due to complications at birth? So there's an implied, these people are worth, need extra attention that other patients do not. Are not worthy of extraordinary care. So
yeah.
And coming to a couple of other themes, also providers it was mostly nurses on this Reddit theme.
Because doctors don't like to tell their secrets.
Apparently, yeah. Or they're getting the kickbacks or something. So pointing at some potential negative outcomes of these things. One nurse says, my hospital has one. It is a catastrophe. People who belong in the unit can insist they stay in the luxury unit, and more than a few have passed away because of this. I'm guessing because they didn't want to move to specialty units, because you can't receive all the care that you might need in your luxury unit, right? If you need a surgery, or if you need specialist equipment, you might have to move somewhere else in the hospital to get that care. But apparently some patients have such a sense of entitlement that they refuse to leave that room.
Yes.
Yeah.
Wow. It's that good. I mean, that's in some ways that's a good sales pitch.
Right. Yeah. So you can literally kill yourself with your sense of entitlement. And then we did an episode not that long ago on nurse staffing ratios. Right. There was one person who was talking about the Eisenhower in Palm Springs, said they have a unit called the Ranker unit where each person has their very own nurse 24/7, to which another nurse responded, wait, there's a place where I can have a one-to-one nurse for VIP patients. How do I apply to this hospital? So you can buy yourself out of the staffing crisis. You can buy yourself out of the primary care shortage crisis. Everything is available to you at the right price.
Is there a problem you can't buy your way out of
the
country?
Okay, so
except for my mental health problems. Sorry. Yes, go on.
That's true. You can buy your way into mental health problems apparently as well. So we talked about a little bit about the downsides of concierge care with physicians and how that is exacerbating the primary care shortage crisis for everyone else who's not in them. What about the downsides of these, luxury units and whole luxury hospitals?
Well, there are downsides. I mean, I think it's worth mentioning, not that anybody cares, but it's actually really unethical.
Yeah.
And I mean, I don't know if I have to go into more details, full stop, it's unethical. Right. The way that I thought, the way that Shoa Clark put it, she was that nurse who wrote the New York Times op-ed I was talking about before, about how the rich hospitals coddle the rich. She said, when I allow one of my patients to be labeled important, do I implicitly label the others as less important?
Is that a rhetorical question?
It certainly was.
Yes.
I get the sense that she says yes. So, I mean, the whole principle of medical care is that people should get healthcare when they need it because they're people, not because...
And they need it.
And they need it. Not because they have the cash to pay for a penthouse suite in the hospital. Right. Another thing though is, you were talking about the way that physician concierge services can sort of draw from the existing primary care pool. But you see the same thing in the hospital, right? It like takes away resources from the rest of us. Hospitals are constantly pleading poverty, right? And in some ways they see these programs like these, like, fancy suites and stuff like the pavilion as a way to raise additional money for the hospital, right, by courting these VIP donors. And in some places, doctors are actually trained to do fund pitches for the hospital.
Oh God.
I know,
Wow.
right?
I mean, that's like, yeah, I mean, if you could buy your way into better treatment and it had no impact on the rest of us, I might not care that much.
Yeah.
But
Yeah.
think about, early days in the pandemic when hospital beds were like really hard to come by, and hospitals were just running out of bed capacity. I mean, what if these whole floors that have these giant fucking hotel sized suites for one bed had a little bit normal sized hotel rooms
Right,
plus
right.
beds? I mean, it could have really increased our capacity and our ability to address the pandemic. And even back then when we were doing the podcast, we were talking about countries that have far more beds per
Right.
population and just had a much better ability to address the pandemic before we had access to vaccines. So.
Now, of course, when hospital administrators are confronted with these like accusations that, they're draining resources that should go to other patients, they always say, no, this is just a question of allocating priority. But I mean, it is kind of a zero-sum game with a hospital budget, right?
Right. Yes.
They can hire a certain number of people, and they need a certain number of people to be butlering to the rich, while the rest of us are dealing with the leftovers. So there's that, and then this is something that, like, you know the word Schadenfreude. Well, of course, your wife is German, so you know the term Schadenfreude, right? Which is a shameful joy, a term only a German would come up with. But it's the joy of something bad happening to someone else.
Yeah, not always shameful, I must add. You can just have good old-fashioned joy.
It's true. It's true. I mean, it translates to shameful joy, but the shameful part has really fallen off over time. Anyway, long story short, I have a certain amount of Schadenfreude about something called VIP syndrome.
Okay.
All right. So I learned what VIP syndrome is from this Boston Globe article from 2016. And basically what VIP syndrome is when hospital staff are basically let me actually just use a description from this Mayo Clinic doctor, Paul Mueller. He says VIP syndrome can lead caregivers to overtreat patients with unneeded imaging tests, for example, or to undertreat them by avoiding biopsies and other procedures that might be upsetting or painful. Often the pressure comes from a VIP's entourage rather than the patient. So basically, when hospital docs are told that they need to prioritize VIPs, this can actually mean terrible consequences for their healthcare and for the hospital as well.
Right. Yeah.
Basically, there's this one incident from Brigham and Women's Hospital from 2016, which is just awesome. This was a prince who had ties, quote unquote, ties to Middle Eastern royalty. And he was admitted to the pavilion at Brigham and Women's. We've just heard all the wonderful amenities.
Lovely.
They have.
Yes.
Yeah. But so the prince came in with some very defined ideas about how he was going to be treated. And some of them, like, violated hospital protocol. So first of all, and this is wild. Okay, this guy was diagnosed with a drug-resistant infection, but when the medical providers came in with protective gear on, like their protective gowns and stuff like that, he interpreted that to mean that they thought he was dirty and he objected to it. Of course, we all know that protective gear goes both ways, right?
Infection,
like
yes.
Part of the deal is to try to protect the patient from infection
Mhm.
or whatever. But so he asked the doctors not to wear protective gear around him, and they made an exception.
Oh, lovely.
Great.
Yep.
Um,
When entitlement runs rampant.
yes, yes. Um, uh, in addition to this, they apparently let his personal aides administer medications,
What?
which
Okay.
is, as you might guess, not the policy of the
Mhm.
hospital. He tipped all the nurses, and this is a recurring problem that I've heard, that I saw in my
Mhm.
research, like looking at different doctors complaining about these problems and complaining about VIP syndrome.
Right.
Is that, obviously in the hospital you are not actually allowed to tip the nurses or doctors.
Right. But if it feels like you're in a hotel,
Yeah, why
that's
not?
kind of what you do, right? I mean,
And so this prince in 2016 just like showered doctors and nurses with
mhm.
crazy gifts, which of course the hospital claims were all returned to the development office.
Okay.
Eh? Um, and then this one's interesting. So we saw the case. We saw that when he had a drug-resistant infection, he objected to the protective gear, right? So there's
Mhm.
that side of things. The other side of things is, that they were willing to do all sorts of things to please him,
Mm.
and that created these like big concerns about whether he should have received all the painkillers that he demanded.
Oh, okay.
Which again
Mhm.
is like a very the diametric opposite of anyone else who goes into the
Sure.
hospital
Right.
and has to demonstrate their pain in order to get
Right.
painkillers,
Yeah.
right?
Mhm.
So yeah. So I mean, this created an internal investigation for the hospital. Ultimately, doctors were very critical of this, and ultimately it brought a lot of criticism also on the hospital for violating their protocols.
Right.
Yeah.
Yeah. So you can actually hurt yourself by being too entitled and
Yeah.
throwing your weight around and kind of being expecting to get, because I think a lot of people think that more treatment is like better treatment also.
Right, right,
So
right.
yeah, and when you mentioned that thing about the Mayo Clinic guy talking about people getting unnecessary imaging tests, and
Yes.
it reminded me of some of these things. You when you sign up for like a concierge plan, you get a free. These are becoming also popular now. These full body scans.
Ooh, I
Like,
really want one of those.
oh God, no! Well, I'm about to tell you why not to do that. These are also, as far as I know, they're considered not necessarily a good thing for your health outcomes because they so often come back with false positives, and
Oh,
they send you off on all these different treatment things, which many so you become it's kind of similar for like doing like there's a big debate about like how early you start uh, doing imaging for breast cancer, and if
yeah.
you do it too early, then way too many women get overtreated for breast cancer that they don't have, and it's kind of similar with a full body scan.
Mm,
But it's also it kind of fits with the general trend here, right? Which
yeah,
is
yeah.
um, once you get into this system, you can kind of you're allowed to ask for more, and allowed to ask for what you think you need, but often that can be more than you should be getting, which can be bad for you.
Mhm,
And
mhm.
most patients are very bad at knowing what they need. I certainly count myself in that category. So
Yeah, 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 often bad.
I know what feels wrong, but I don't know what I should be doing about it.
I know what feels
Me and
wrong. The
WebMD,
Ben
we're
Day
really,
story.
really good.
Yeah. So, I mean, WebMD is a concierge service of sorts, right?
God.
But in general, I gotta say, so we went into this episode, and I have to say that I expected to like be disgusted by the introduction of like unnecessary luxuries into the healthcare system.
Mhm.
But doesn't it sound like some of this stuff, sort of like you mentioned before, is just kind of like decent healthcare?
Yeah. We can talk about this. It's because some of it is like, the whole reason we're fighting for Medicare for all. And if you have a good functioning healthcare system, then you won't have a massive primary care shortage. You should be able to get same day or next day visits with your doctor when you need it. That's like a measure we use when we're comparing U.S. healthcare system to other countries that have, universal healthcare systems. You can generally get a first day appointment within 24 hours. Same thing with staffing ratios. Like you shouldn't have to buy a luxury good to get like decent staffing. I mean, I don't know that you need a 1-to-1 nurse ratio when you're not in an urgent setting or an emergency setting, but you should be able to get the medically necessary and appropriate staffing levels. So so some of it is just like our healthcare system is so broken that it's created this market for rich people to buy out of it just to get the care that they need. But then there's clearly an extra level, right? Which is like wanting to continue to have an unbroken experience of luxury in your life, perhaps from your day-to-day life through your medical experience back to your day-to-day life. That I don't give a shit about. That is disgusting to me. And especially when it's worse for the patient and negatively impacts other people in the hospital. So I don't know. I have a mix of disgust and like, oh, these luxury plans are just kind of doing things we should be doing for everybody. And we could win with Medicare for all.
So I feel like that's like the point, right?
Right.
We all deserve nice things. Sometimes celebrities don't know what real nice things are. Or rich people don't know what real nice things are. And also Medicare for all would mean that we didn't need this shit to make people feel like they're being taken care of.
Right. And I have to say, I think our hospital rooms could look a little nicer. Just a little bit in the hotel direction.
There was that one article that we found that was talking a little bit about how hospitals reserve their top floors for these luxury suites. But it turns out that there have actually been studies that show that having a room with a view can help you to heal faster.
More sunlight, all that stuff. Why don't we give those rooms to the people who need it the most, like mental health issues or something? Needs based, not rich people based. But all right. Well, I learned a lot today. I didn't know anything about any of this shit that was going on. That's how far away I am from the other half, that I didn't even know what they were up to.
It's nice to check in on them from time to time.
Yes, exactly. So I hope we all get the good parts of what they're getting right now. And if they want to, once we have Medicare for all and decent healthcare for everyone, if they want to buy their fancy ass rooms that they're not taking from the rest of us, then fine with me. Have at it. So
go to it.
All right. So I want to thank our podcast team, Jillian, our wonderful, wonderful podcast team, our podcast manager.
Great. They are just great.
Awesome.
Yeah.
Podcast manager, as always, Angelique Davis, our show notes writer, as always, Jerry Katz. Our audio editor for this episode was Irina Budanova. So please don't forget to like this episode. Subscribe to the Medicare for All podcast on your favorite platform. And this show is a project of the Healthcare Now Education Fund. And if you want to support our work, you can donate at our website, healthcare-now.org. Thanks all. Have a luxurious next week or two.
Stay safe and stay dangerous.